other retailers. And I'm going to briefly introduce Dr. Salas and give the floor to him. At 1:45, we will open up the floor for questions and answers. All right, Dr. Jesús Salas, PSYD, ABPP, is a clinical psychologist and director of the Center for Integrative Psychotherapy in Allentown, Pennsylvania. Dr. Salas has an undergraduate degree in psychology from the Catholic University of Caracas, Venezuela. He holds a master's in social psychology from Carleton University in Ontario, Canada, and a master's and a doctorate in clinical psychology from the Philadelphia School of Osteopathic Medicine in Philadelphia. He is a clinical supervisor and adjunct faculty at the Beck Institute for Cognitive Behavioral Therapy in Philadelphia. Dr. Salas is also a psychiatry resident supervisor for the joint Lehigh Valley Health Network, University of South Florida program in Allentown, Pennsylvania. Until last year, he worked as a clinical assistant professor at PCOM School of Professional and Applied Psychology, and he did this for 18 years. Dr. Salas is board certified in behavioral and cognitive psychology, Board of Professional Psychology. He is a cognitive behavioral therapist certified by the Beck Institute for Cognitive Behavioral Therapy and a certified therapist and consultant by the Academy of Cognitive and Behavioral Therapies. Dr. Salas specializes in treating anxiety and stress-related disorders, OCD spectrum, and depression disorders. His current research interests focuses on feedback-informed treatment and client's attribution of progress. His latest book, Getting Better Every Day, The Client's Guide to Cognitive Behavioral Therapy Treatment, is aimed at helping clients to optimize their therapy experience. And with that, we welcome you, Dr. Salas, and look forward to you enlightening us on the publication and writing process, as well as on the book itself. Thank you.
Thank you so much. Thank you for the opportunity. It's great to be here and great to be in anything that is related to PCOM, which I keep always keep very close to my heart. This book, and thank everyone who attended this. Hopefully it will be useful and interesting to you. This book, I started to write as a result of doing therapy and realizing that people don't make the most out of a therapy experience. I mean, the CBT, the cognitive behavioral therapy tools that we have are very powerful opportunity for people to change. But I was frustrated to see that if people knew more how to use the experience of therapy, they can make even bigger and faster changes, so more changes that can generalize more to their lives. So that's what inspired me to write this book, which took me a while because it was collecting information from patients, seeing how they're learning. The book is a lot about learning to learn and learning to learn emotionally, which is the most difficult learning. It's to some extent easier to learn intellectually. But you know, how people learn to change their emotional responses to things and their behavior, it's one of the most interesting thing and challenging things of our profession. So that's what inspired me to write the book. One of the essential ideas that I wanted people to know about therapy is that therapy, even though it's called therapy, is different from a physical therapy or medication therapy, I mean, medicine in general, or surgery. And here, in cognitive behavioral therapy or in therapy in general, you know, therapy is not something that is done to the patient. So I wanted people to say, like, this is not something going to be done to me. I'm not a patient as such. It's basically something that I do under the assistance and guidance from an expert, the therapist. But if that's the case, you better know, you know, how to make the most out of that. You should not rely only on the therapist to know what's going on. The more you know about the process, the skills that you need to learn, how the therapy and the sessions are structured, the better, the maximum benefit you're going to get from that. So that was the rationale to write that. You know, I'm very passionate about what I do, and that's probably another reason. I mean, I like the process of helping people achieve changes that I never thought they wish, but They didn't know how to accomplish that. I organized the book in 3 parts. One is information about CBT, and more specifically about how, what can explain from a cognitive behavioral standpoint, what explains the behavior. Even more important is like what explain how people who want to change cannot change. That's one of the most intriguing and frustrating thing for patients. Most patients are interested in changing, have tried many things, and either they relapse quickly or they don't get enough changes to make a significant change. So part of that was providing information to help understand what's driving the behavior, particularly the stubborn behavior, dysfunctional behaviors that people want to change and find difficult to change. The second part is information about the actual therapy. And I'm going to be more detail about that. And then the third one is a notebook, the third part of the book, which is sort of a guideline for people to use throughout the therapy to know what are the key things to consider before therapy, during the session, and after the session. Okay, we know that writing about it makes a big difference. Writing about the experience in terms of reflection, also in terms of memorizing, and also in terms of thinking, how can I apply that to really produce learning that I can use in real life? So that's why we're going to the book that way. The first part, it's about, I think, six chapters, because different aspect of the learning part, with examples of that, and of course, changing any anxiety disorder and trauma, OCD, depression is a complex process because there are many factors that play into that. So I didn't want to present any unrealistic, very promising, but unrealistic view of how people change. So that's what I say, that this is a book that is not, you will enjoy it, but it's a book for change people's lives. So it's realistic in terms of the kind of effort, work that needs to be done, and the complexity of the process of change. Part of that section is to talk about the motivation and enhance the motivation of people, and make them realistically optimistic in terms of what they can do and what kind of effort and commitment they need to put in to get significant changes. And the last emphasis of that section, the first section, is, teaching people, learning how to learn, which sounds like a paradox, but it's a really critical thing. If I'm surprised, for example, people go through experiences and their focus is more, and I'm glad that I don't feel bad. I'm glad that now I don't feel that bad. There's little learning in terms of how did I learn this? What allowed me to get from here to there? In what context this works, in what context didn't work? So to instill that sense of curiosity about the learning process, which we might consider that like a meta skill that the person will learn to use in many, many situations. So, I have plenty of example probably in the Q&A that can give many examples of how people go through the process of applying all this information from the book and to therapy and their regular life, so they can actually turn that into stable changes for them. The second part of the book, it's related to more how the therapy is organized. For example, what is a typical course of therapy? What is the structure of a typical therapy session, which in cognitive behavioral therapy is very unique. And some people don't like it because it's very structured, but we find that that's what translated into better results, which basically involve, aside from greeting the patient, establishing the agenda, how we're going to use the session to maximize the time, because it's going to be very time limited. Reviewing anything important that happened during the week to see if that needs to be incorporated into the session. Reviewing the homework, and part of it, therapy is explaining that homework is not like a school homework. It's anything that they see that it will be useful to do between sessions to reinforce the learning. Okay? And again, it's not only intellectual learning, but emotional and behavioral learning. So we'll review that, review what they learned from that or the difficulties, then go into the agenda items, making a summary of the agenda items, see what they learned about that. And then after that, go into homework again for the following week. And finally, review on the session in terms of a summary and evaluation of the session, which again is very structured, but it's what we found that can maximize or optimize the time that we're having with the patients. Normally, patients don't have an idea of this. Even when they have been in CBT, frequently it's a watered down cognitive behavior therapy. They think it's about talking about their feelings, which is true. It's talking about their feelings, but it's much more than that. Normally, when I treat people who have been in therapy, even in cognitive behavior therapy, the structure of that seems to be new. In reality, it shouldn't be new, but it's again not that commonly used in certainly in other forms of therapy, and even in people who practice some form of not strict cognitive behavior therapy. In terms of skills, we teach them, for example, how to organize their time, and that so they can make the most out of that, how they find agendas for the session, and what's useful on agenda, what is typically not that useful on agenda, how to define goals, again, goals that are useful. Patients have goals that frequently there are good wishes, but they have little power to energize behavior. So we help them translate into sort of instrumental goals that are going to be more engaging for them and more useful, because it would allow them to sort of measure how I'm achieving that goal. How would I know that I'm achieving that particular goal? So it's very educational process. We normally, more than didactic, we go through the examples of the person and we explain all that. And, the second part of the book explains all that process. And then we go into the personal skills. For example, the person needs to change. Very seldom anybody in therapy, patient meaning, think in terms of the skills to change. Sometimes they think about coping skills, but not, skills that they need to achieve their goals. And for example, they get surprised to think that they need attention skills or improve their attention skills. They need interpretation skills to make it more objective, more flexible, more functional according to their goals. That they need, they can learn emotional skills. So all that, it's information that is typically new for patients. The other type of skills are coping skills. That's more familiar with people that, and oftentimes they come, I want to learn some coping skills, which is part of the repertoire, but other skills that it will enhance their experience. And what I call consequence skills is learning, see the connection between the emotional and social consequences of how people cope and interpret things, and learn how to manage that for their personal therapy goals. So it's pretty challenging to do that. At the same time, it's a really interesting process because we're using their own personal experience, their own data, to illustrate that more from an inductive point of view, meaning is that the person presents a problem, the difficulty had that week addressing this, and then we sort of break down and dismantle that into these components and apply the skills. Or sometimes a session are just training a particular skill, okay, which might be learning how to divert the attention from this particular obsessive thought to something else, or how to tolerate a particular distressing emotion like anxiety. Okay, the patient might typically come with the idea, all I want is to get rid of my anxiety, and we're teaching them to. That's a totally understandable goal. However, that's not necessarily the most useful instrumental goal. So part of the goal is to teach them how to tolerate the anxiety, and then tolerating the anxiety, learn how to respond to Could be a pretty scary situation in a different way. I, have many examples of the applications of this, so the person can actually see through the examples what are we talking about. Again, part of the challenge for me was not to. I normally tend to write more for academic things, so not to make it too academic and not too abstract, so the person can see the application of that, and that's why I had so many examples. Hopefully the language is simple enough. What my patient said, it's not an easy reading in the sense of there's a lot to think, but it's not complex in terms of the language is too technical. And the examples really illustrate, I think clearly, what is it that we're trying to illustrate with that. And then the last piece is the notebook, which, a typical thing of a patient, it could be, one thing I teach my students, for example, and I practice myself, is at the end of the beginning of the session. Also, I do it sometimes at the end, but at the beginning of the session, I said, okay, could you make a summary of the main things from the last session? Or what were your takeaway? How did you apply that? And usually the person said, frequently it's like, oh, that was a really good session. I like it, but I don't remember what we talked about. Or one person, said, oh, yeah, I think I need to take notes because, I remember while I'm here, but as soon as I get into my car, I typically forget, the main things that we talked about because I don't think about that. So a way of minimizing that is, writing what it is. And some of that we do it in session. For example, I can ask the patient, okay, let's write down the core things you are taking about that. Read it back to see if there's anything that I think it was important that you missed on that. So we go over that. But all that is out in a notebook because normally people have all kinds of papers and then they forget the papers or they miss the papers, they lose the papers. So that's what I thought it was useful to have a book that explained in terms of when you are going to a therapy session, what is useful to think before that, what is it you want to write, and that will help memorizing. During the session, what kind of things you can write in the session or right after session. And then, throughout the week, any other information that could be useful to the goals that the person had. So it sounds sort of academic, but it's not. It's basically organizing the experience and increasing awareness of what's going on. And that how is that related to the therapy goals and the learning process or the phase of the learning process that we have at the moment. And people find it very useful because they help them to know, what are the key things that to keep in mind. And not writing typically produce a lot of memory loss. Okay. Another thing that is interesting about the notebook is that 10 sessions down the road or 20 sessions down the road, the person can go back and compare the notes that has at the beginning of the therapy versus, say 15, 20 sessions after, and see the differences or check how, for example, in some cases, the person said, wow, I realized that the underlying issue is the same since the beginning of the therapy. I mean, I have talked about even superficial things, but I'm dealing with the same issue, and reading my own notes helped me to have more awareness of that. And there's more commitment because you have it right there. You're writing that, and then you can review it every time. Part of the homework could be to review your own notes. Okay, again, to keep that awareness and keep more focus in terms of the goals that the person has, and then want to accomplish from one week to the next, or in the process of several weeks. It's really interesting to do that. One interesting study is that when people type notes, or when people write by handwrite in the notes, normally the people remember better when people handwrite the notes than when they type. I don't know exactly. It must be something neurological, but somehow there is better learning when the people write on a piece of paper than when they type on their computer. So in this case, you know, it will go to my advantage to people writing on the book, because it's designed to write on the book, what's going on. And that's kind of the last piece of that. So yeah, I think that those are the main things. Probably I can have many examples of how the application of that, but probably would like to hear also in terms of the process of writing the book. This is my third book. The motivation, I've been different because there are different books that I have written, different publishers, all about psychology. But it's as I said, the motivation is more really think of in terms of what could be helpful for the patient. The process of writing, I've been super busy. So for me, writing was writing an hour at 5 a.m. And not every day, because sometimes then I was exercising. So to write was that, and then doing that on a Sunday. Yeah, take a long time because again, I'm preparing workshops for the Beck Institute, or supervising students from PCOM, or supervising psychologists from contract that the Beck Institute has, or the Academy has. So, but I was persistent, and over time I finished the product that I thought it was enough for the goals that I had for the book. It's very satisfying. The most difficult thing is to translate that into a language that is not that technical. Probably that was the most challenging thing for me. What is too abstract, I realized that the more the abstraction, the less the person will remember, the less the person will know how to apply that. So I tried to make the language, even though I'm talking about abstract principles of learning, make it very concrete so the person can relate to the material. That was challenging, and that was an interesting experience. So of course I wrote many versions of that. I tried with patients to see, what could be too abstract for them, too dry for them, what they needed to be more engaged. And again, that was an interesting process by itself, to learn that. I realized that people remember much more, even verbally, when it's not writing the book or reading a book, anecdotes and stories, which I connect with an abstraction, but without a story of that, the person remember less. So sometimes, or oftentimes, people said, I remember the story that you told about this patient, which is basically a metaphor to illustrate how improve their understanding of something that they're going through, or how they apply, reframe their situation. It might seem hopeless or too difficult into something hopeful, optimistic, and what kind of things can be done for that. And people remember more stories than principles and abstract ideas. So that was pretty interesting. Go myself as a writer for that purpose to switch from a book that probably sound too academic to a book that it's more interesting and engaging for someone who is a regular person, not interested in academic stuff. So I enjoy that very much. And what else? I mean, it was more of that. I mean, in the process of writing, having the perseverance of finding half an hour there, an hour there, and managing with all the things. My role as a husband, wife, my time with my wife, time with my kids. It's challenging. That part is very challenging, but I guess if we persevere, we do it. I had the experience of the other two books, so that also gave me some training for this one.
Dr. Salas, are you ready for the audience to ask you some questions?
Yeah.
Okay. It seemed like you were kind of wrapping it up a bit, so I thought, well, I'll step in and change the tempo a bit.
Right.
So I actually do have a question for you, Dr. Salas. From inception to publishing, how long did it take for you to produce your third book, Getting Better Every Day?
It was, he will laugh, but it was like 10 years because I had to write it and put all these things. Sometimes it was 6 months that I couldn't write because I was writing workshops for this or research papers or other things. So between one, since I thought, okay, I'm going to do this, and then it was published. That was the range of time. So you can think that I'm persevering.
That actually is persevering. I don't know if I could stick it with anything for 10 years. Actually, there is one thing I can think of. I'm doing it right now. There's a question in the chat. What was the editing process like for you? And feel free to speak on this book as well as your experience with the other titles that you've produced.
It's really interesting because, of course, I'm writing from my own perspective, and the publishers have a very different perspective frequently in terms of the audience, the marketing, the language. So I was particularly interested in the criticism in terms of don't write this way. This is too wordy. Make it more simple, and all that was the most interesting part of the for me from working with the publisher about the book. And it was the same thing for the other books. The second book was a professional book, but it was similar type of experience. I wrote it with a co-author, and there were many criticisms at the beginning. I was really surprised. So many red things were there, but I learned that they were useful. And then streamlining the manuscript was a really interesting exercise for me. I mean, I find it useful, even though it could be frustrating sometimes. It's like, how am I going to say this? Or if I sacrifice this, I might be missing something important. But at the end, no, I mean, it's an interesting exercise that way. And that's probably the most important thing with that. But, editors question, again, they have a different view. So it's to question all the development of the books, how they approach that developmentally, and how do you want to, end up with this product is also interesting because they have, again, a different view in terms of how that should come about.
So was this book a departure for you? You've made mention or reference to how it's written more from a layperson point of view, because it really is a book to help people get the most out of cognitive behavioral therapy. So is that a departure from the other two books that you've written, or do they all fall within kind of that same vein?
The first one was also for patients and more like in general public. It was not even for patients, it was the general public. It was called Social Intelligence, but that was published by Spanish. It was in Spanish, and it was published by a Spanish publisher. The second one was academic book for professionals. It was about panic disorder, treatment of panic disorder from a cognitive behavioral perspective. So that was strictly academic, more professional than anything. So then we could be dry, then we can be, go into the specifics of this and that. And then after that, it was more writing research papers or workshops that were pretty professionally oriented. So this was a departure in terms of, how to go back after so many years to write for the public.
For the audience here, you are certainly welcome to unmute and ask your questions directly to Dr. Salas. So I encourage you to just introduce yourself and let us know your question. I have one. As far as the book's focus for the patient's use, are there markers in the chapters or in the sections in the book which give indications of like maybe milestones that they've reached, so that they know that they're making progress in their therapy? How did you lay that out?
It's presented in terms of what does it mean, for example, to develop, say, the skills of cognitive flexibility. It means that when you're able to do this, or attention flexibility, or attention sustained focus, So yeah, I describe what is each of those things. So because it needs to be very precise. I mean, using a language that is vague typically is very confusing. It gives false hope or a sense of direction. So it's very specific in terms of that, precisely for that reason. I wanted people to know, oh, this is what it looks like, and this is what I'm trying to accomplish. Yeah.
Did you write the book with a specific population in mind, Dr. Salas?
Not. It could be used for any person who is in CBT therapy. I mean, for example, I don't specialize in substance abuse, so I have, almost no examples on that, or eating disorders because I don't normally work with that. But it's most of the examples are more, which could be used with eating disorder too, but it's more everything that is related to anxiety-related disorders in the broad sense, stress-related disorder, OCD-related disorders, adjustment disorders, and depression. So, which is a really broad population.
One of the questions in text was, what is your preferred reading material? Do you read nonfiction or fiction? What is your preference?
A nonfiction.
Ah.
So,
as a good scientist.
Yeah, history and science. I mean, I read pretty much journals every day. But yes.
How did you find working with your publisher? Did they assist you with the editing process? Work for you?
It works fine, and this was divided in the sense of this. Fulton is a self-publishing book, publishing company. They give you, they offer editing process, but it's a self-publishing book, so their editing process was not as extensive by the typical commercial publisher. So I hired a publisher to work with that piece. So she was much more critical in terms of this is what you need to do and this is that, because they tell you, we're going to suggest things about grammar and things like that, but we are not going to change anything substantial from the book. So if we approve your book, it's going to go more or less how it is, the manuscript. So, I wanted more advice in terms of that. So I hired someone to work with me through the whole process, which was very, very useful.
Was that expensive?
Yeah, I mean, it was, I think about $5,000 or something. Close to that. But worth it, because it's really a lot of work. When it's detailed work, I mean, it's really reading the whole manuscript, it's suggesting the construction of the sentence. It should be more like this, if you read more like that. We're missing an example here. So it was really, I really love the exercise.
Great.
So you've done this a bit already. What was the moment at which you realized that you wanted to be an author? Can you describe that moment for us?
Probably since I was little. My father published some books, my grandfather published some books, so we had tons of books at my house. When I say tons, it's like hundreds of books. So it's like, for me, it was pretty sort of familiar experience. So I thought that eventually, I mean, I want to write some books. So I didn't know about, exactly what, and when I was in high school, I was not thinking about that. I mean, it was just that it's familiar to me, it was interesting to me to read books. But once I was in college, it was more like, well, I want to put some of my ideas into books. So eventually, then I started.
We have another question from the chat. Did you have any scientific writing instruction during your student days at PCOM?
Writing the dissertation, yes. I mean, the dissertation was reviewed by an editor, and then, but of course, it's academic writing. But still, it was more coming from my advisor and from the editor of the dissertation. which again, it wasn't extensive and it was more limited because I was more used to write for journals and things like that. But yeah, that was the training in that sense. I think that now probably we're offering more than when I studied. But that was the training that I got from them.
So now that you have a bit of, you have more than a little bit of experience under your belt as an author, if you were talking to somebody who's brand new to the process and they asked you for 3 things that you wish you would have known before getting into this whole publishing deal and producing these books, what are 3 things that you wish you knew before starting the process of publishing?
One thing is to have probably more defined idea who exactly is the audience of that. I mean, I have a general idea, but to define who do I want to read this book, it's aimed at home. That's one thing. Probably another thing that was interesting for me was to learn more of the language. And again, based on that, for me was a really learning process. I mentioned to think that, okay, if I'm gonna write this for patients, I need to really think in a very different way when I'm communicating myself. So to be mindful of that, it's another very important thing. Maybe a third one, I don't know. I mean, it's based on that, who to choose. I mean, that was difficult to initially what will be a good publisher for this, and I didn't have too much information in terms of who can publish that can deliver what I wanted. So I could have learned a little more about different publishers and for this particular type of book. Again, it was more familiar with for professional academic books.
So if somebody is looking at the synopsis of this book and they're wondering, is this book for me? Like, will I get any usage out of it at all? Who is this book for? What do you tell somebody who's asking, should I read this? Would it work for me? What would you say to them?
If you are not fully happy with the changes in your life that you are trying to accomplish, even if you're in therapy and the therapy is not allowing you to change fast enough, extensive enough, stable enough in time, then the book could be helpful because it will really spell out what are the components of the process of change in therapy and how the actual learning in therapy happens to accomplish those goals. And, fortunately, I've been sort of a witness, a facilitator of this type of changes. So, I can attest how important these things are and how even with cases who have a long history of problems, how they can actually change when they are learning how to learn. Okay, so it's for that. I mean, I treat a lot of people who have been in therapy before, with again not fully happy with the changes in terms of the magnitude of the changes or stability of the changes. So that's more what I would say with someone in terms of this is the reason why the book could be very useful to you.
Are there any other questions from the audience? Well, thank you, Dr. Salas, for stopping by and talking with us about your very interesting book. We appreciate the opportunity to share your knowledge with the PCOM community, and I wish you a great day. Thank you again.
Thank you so much. It has been great to share this experience with you guys. I mean, and I recommend it to, I mean, if there are people in the audience that are interested, I mean, you can email me If you have any specific about that, my email is Salas at, the correct order for salad rather than salads, but it's Salas, S-A-L-A-S. So Salas at CIP-CBT, C as in cognitive behavioral therapy, CBT.com. That it really a rewarding process. Typically, again, requires very persistence to do it, but it's really worth it. And the experience with people who read the book is typically very, again, rewarding.
Thank you again, and you have a great evening.
Thank you. You too. Thanks so much.
Bye now.
Bye-bye.